My name is Jacob Marx, and I'm excited to present the research that I have performed with the following contributors. Our project is titled Influence of Clinical Experience and Training on the Management of Sinus Perforations in Dental Extractions. An oral antral communication is a pathological link between the oral cavity and the maxillary sinus that commonly occurs during dental extractions. The size of the perforation varies, and treatment options include both conservative and surgical interventions. Our study aims to investigate how dental practitioners manage sinus perforations of varying sizes during dental extractions, considering their level of experience and education. Our study consisted of a cross-sectional survey which collected demographic data and assessed the respondents' knowledge and practices regarding sinus perforations. We collected data from 60 survey participants with an emphasis on their preferred management strategies for small, medium, and large perforations. Of the 60 respondents, 1 recorded they obtained a bachelor, 20 attended a residency program, 7 completed a fellowship, and 31 only completed a doctorate program, while 1 selected other. 13 of the respondents were female, while 46 of the respondents were male. Most of the respondents to the survey fell between the 40 to 49 year age range, but we did have representation for each category. Regarding years of practice, our 2 most common groups of respondents were those with 11 to 15 years of experience and those with 20 plus years. When examining treatment techniques for small perforations, it was interesting to see that most practitioners used collagen-based materials. It's also interesting to note that 30% of practitioners did not include any additional treatment, allowing the perforation to heal on its own. Referral to specialists in collagen-based materials were the most common techniques for moderate-sized perforations. Lastly, for larger sizes, most practitioners referred to a specialist and other techniques such as allografts, buccal fat advancement, and primary closure were used. While we do see some of those techniques for both small and moderate perforations, we do see an increase of usage in the larger sized perforations. For small perforations, 0 to 2 millimeters, practitioners with over 20 hours of exodontia experience were the largest group using collagen-based materials with or without sutures. For moderate perforations, 2 to 6 millimeters, practitioners with over 20 hours of experience predominantly managed cases using collagen-based materials with or without sutures. In contrast, referrals to specialists were chosen across all experience levels, reflecting shared reliance on expertise for more complex cases. Regarding large perforations, practitioners with over 20 hours of experience were the primary group making referrals to specialists, followed by the use of primary closure techniques. Less experienced practitioners under 10 hours were less likely to attempt advanced interventions independently. Looking at the results emphasizes the fact that there are a variety of techniques that practitioners use depending on their training and experience. Dental schools should incorporate comprehensive training on sinus perforations as part of their core curriculum. This can help students build a solid foundation in prevention and management techniques. Additionally, continued education and residency programs would keep practitioners updated on new evidence-based practices. Standardization of guidelines would facilitate a uniform approach to managing sinus perforations, ensuring that patients receive the best possible care regardless of their geographic location. Teleconsultations would allow practitioners in rural areas to be able to consult with specialists. The use of advanced imaging technology and diagnostics would allow practitioners to better plan their approach to minimize the chance of a perforation. Lastly, ongoing research can evaluate the effectiveness of different biomaterials, grafts, and closure techniques, helping practitioners choose the most reliable and effective treatments for their patients. I want to thank all of the following for their support and contributions to this study, specifically the Clinical Outcomes Research and Education Center at Roseman University College of Dental Medicine, Dr. Man Hung, and the following contributors listed below.